I've continued to work to do that. As governor, I was really, really proud of the fact that New Hampshire became the first state in the country to repeal sub-minimum wages for people with disabilities, something actually the business community really advocated for, and I was very glad to champion on their behalf because they began to realize that their employees who experienced disabilities were contributing just as much as all their other employees were, and they didn't think a sub-minimum wage was fair. Well, thanks for having me. I'm excited to be with you, and I'm excited that you have this show. It's a really important thing to be doing.
Of course. So if you're ready, we're going to kick off with our first question.
Sure.
So I understand you were self-isolating in DC for a period of time earlier because of your son Ben's compromised respiratory system. I want to share with you a situation that was brought to my attention. What if somebody has a high-level injury like your son who has no other family members and relies on a caregiver? And in the meantime, that individual who happens to have a severe disability contracts COVID-19. What protocols are in place to allow caregivers to come in to provide services to that specific person?
How do you plan to make sure that somebody who might need special equipment or extra time, let's say, can be either evacuated, or in the event like a pandemic where people are staying in, how do we make sure we get meals to people? And in some cases, for people who experience disabilities, those meals may need to be specially prepared or specially delivered too. So those are some of the things that we've really been working to do, is increase the amount of delivery capacity we have for people who are now isolating at home. And then again, working with the direct support community to make sure that those workers are protected and trained so that they understand how to minimize their own risks as well as the risk to the person they're caring for in a home setting. But in terms of overall disaster and emergency preparedness, I think we still have considerable work to do. The other thing that was very important to me, and has been something I have wanted to help facilitate for a long time, is that when somebody with a disability needs to be hospitalized, we want their direct care professional to be able to be in the hospital with them and get paid for being there. In the past, once somebody has gone into the hospital, the direct care professional hasn't been paid, so doesn't come into the hospital. And as I think most of us know, for somebody who has complex disabilities of any kind, the absence of a family member or a direct care professional who understands them, knows their routines, knows the way they communicate, can be absolutely essential for their health, as well as for their overall sense of well-being. The reason I got drawn into public life was really because I had become, as so many family members of people who experience disabilities do, I had become an advocate for our son. First in school, we had a cooperative and supportive school district, but still you have to push, you have to really advocate for your family member. And so that's eventually what drew me into public life. And I still remember, as a new state senator, realizing that New Hampshire's state law didn't really enforce disability discrimination laws the same way the federal statute did when it came to discrimination in employment, and needing to really engage with my colleagues to help them understand why it was so important to enforce the reasonable accommodation rules in state law as well as in federal law. And that was just an example of some of the perspectives and experiences I was able to share with colleagues eventually to change the law. I've continued to work to do that. As governor, I was really, really proud of the fact that New Hampshire became the first state in the country to repeal sub-minimum wages for people with disabilities, something actually the business community really advocated for, and I was very glad to champion on their behalf because they began to realize that their employees who experienced disabilities were contributing just as much as all their other employees were, and they didn't think a sub-minimum wage was fair. What I've tried to do since becoming a member of Congress is just stay focused on the way the laws we pass and the things we fund in Congress impact people with disabilities and their families and communities all across the country. So in addition to really trying to raise the voices of people with disabilities as well as chronic and complex medical conditions during the whole debate about whether to repeal the Affordable Care Act, I've also focused on a couple of other things. One is fully funding the Individuals with Disabilities in Education Act, or IDEA. Your listeners, I think, will know that law was passed back in 1975, but has never been funded at the level Congress initially intended, which is 40%. So I'll continue to push for that. I also am aware of the barriers, many of which are pretty bureaucratic, that exist for people with disabilities who are matriculating from high school to higher education. So I've proposed the RISE Act, which would make that transition much more seamless and much more similar to what people who don't experience disabilities go through when they're matriculating. So those are a couple of the things I've really worked on. And then, we've already talked about some of the things that I've done that are particular in response to the pandemic. But one of the other areas that we're really exploring right now is how to get emergency funding to school districts to use to particularly address the needs of students with disabilities during this period of remote learning, because there are some real particular challenges with that. We talked a little bit about my being the mother of a young man with disabilities. What I really have focused on throughout my career is just saying to people, I want the same thing for my children that you want for your children. And the desire to build a better future for our kids and ourselves is a universal human desire. It doesn't matter whether you experience a disability or have a family member who does. It doesn't matter if you've had lots and lots of advantages in life. It doesn't matter if you come from a part of the country that doesn't have enough broadband, or you come from a family that struggles to make ends meet. Everybody wants to build that better future and have a shot at experiencing the best that our country and our globe has to offer.